I have Dr. Joe Vandermeer with Holland Hospital Medical Group here with me. And Dr. Vandermeer, we've been talking about long haul COVID and COVID in general and how that affects the ear, nose, and throat. Can you just talk about how COVID gets into our body?
So it's a viral infection, and people who are infected breathe out droplets of vapor that have the virus in it, and that goes in through your mouth and your nose. And it sits down on the lining of your nose, and the viral particles have a little hook that holds on to certain receptors on the lining of your nose. And there are certain cells in your body that have this receptor. In this specific infection, it's called an ACE2 receptor, which is a little machine or a sensor on the surface of the cells. And the virus holds on to that and then puts its RNA into your cell to make more of itself. Now, there are certain cells in your body that have this and certain cells that don't, but a number of them are in your nose and mouth, including the surface of your nose and the lining and some of the cells that help support and keep the smell nerves healthy, and also the nerves that give you taste on your tongue.
What are some of the effects that you are seeing due to COVID in your office?
One of the first ones that everybody noticed pretty quickly was that a lot of people lost their sense of smell, and the estimates varied quite a bit, but it was somewhere between 50 and 80% of people lost their sense of smell, certainly in the first couple of days, sometimes as an initial symptom. Sometimes people would have the loss of sense of smell even before they developed fever or so forth. One of the thoughts was that would actually be a good screening tool for, do you have COVID, as opposed to taking your temperature, can you smell this? So it's quite common. That can be from a variety of things. One could be if you're really congested and air and particles can't get up in your nose, you can't smell them. That tends to go away pretty quick because the congestion goes away. But it does also infect, there are these little cells around the smell nerve cells, they're called sustentacular cells, and they have this ACE2 receptor. And when it damages those cells, those olfactory nerves, the smell nerves in your nose, suffer as a result.
I know we've seen taste and smell prolonged in some cases of people with COVID. Can you talk about what that looks like? I know it varies as far as time goes, or ways that can be treated.
Yeah, most people, 50 or 60% of people will get their sense of smell back within a week or two. And something like 70 or 80% will get their smell back within about 6 weeks or so. The remaining people with a sense of smell loss might not have sense of smell even out to a year. And at about a year, only about 7% of people still have a loss of sense of smell. But as it goes on longer and longer, the likelihood that you restore that sense of smell goes down somewhat.
Can you talk about, Dr. Vandermeer, hearing in this whole situation? I know there could be a possibility of some of your hearing being affected.
So there are a couple of routes that could happen. One is it could cause inflammation of the back of the nose, and there's a tube that connects your ear to the back of the nose. And so oftentimes when people get a common cold, the tube that lets air into your ear, like when you pop your ears, that will swell shut, and then your ear can fill up with fluid. So that's one common way that it can happen. But as COVID gets in, either through invasion into the nerve around the roof of your nose, the smell nerve, or streaming through the blood, it's pretty clear that COVID gets into your brain tissue as well. And there's actually a study that has found COVID RNA, the genetic material inside the inner ear. So it clearly moves around. Now, it doesn't seem that it causes a lot of hearing loss, or at least we haven't seen clear evidence that that's the source of the hearing loss, but it's certainly possible. It certainly seems to cause more ringing, so a number of people have a sense of ringing in their ears as well.
I know we were talking about the difference between taste and smell, and some people come in and say that they have one symptom, but it might be something that's actually going on in your brain. Can you talk a little bit about that?
Yeah, so your sense of taste is actually not one thing, but two things. So your sense of taste, you actually can only really taste four things. You can taste bitter, sweet, salty, and sour. And then you can feel. That's the word for that is umami. It's the kind of the texture of stuff in your mouth. But that's it. Your taste buds don't have more distinction, but your sense of smell has a much broader array of things, which is why when people taste fancy wines, they put their nose in it so they can really smell it. Or when you walk into a coffee shop, you say, wow, coffee tastes great, but it doesn't really, it's really bitter. right? But it smells wonderful. That is a big distinguishing characteristic. So some people come in and they say, I can't smell, but I say, can you taste salt? So if you take table salt and you put it on your tongue, that's one factor. If you can taste the salty flavor, then you can taste, you just can't smell. As opposed to, and COVID does actually affect people who have difficulty with taste as well, where they can't taste sugar or sweet or anything. And when they really have both, then they're in real trouble and it gets hard to smell or taste your food. It's very disappointing.
Dr. Vandermeer, if you can just explain to us, I understand that you all are seeing patients that are having some balance issues. Can you tell us a little bit about that?
We actually don't really understand that very well. One of the problems is it seems that there is virus in the inner ear, but it's unclear that that's actually the source of the balance trouble. So balance trouble in general is actually really complicated because your balance is not just your ear, but also your eyes, which show you which way is up and down, and your muscles and your joints and your guts and everything that feels down. And then your brain takes all of that information and it puts it into a math problem and it says this way is up, don't fall over. Any dysfunction of any of those systems can cause you to be off balance. So if you can't feel your feet, it's hard to feel like you're stable. And if your ear is telling you you're spinning when you're not, it's hard to feel stable. In this case, it seems that this is probably actually a brain problem where you're having trouble doing just like when people feel like they have this kind of brain fog and this mental confusion. It's a similar kind of thing where you're having trouble with integrating those different senses. It's a pretty complicated process that your brain does for you that you don't have to think about. But when it doesn't do it, it gets really disconcerting and frustrating.
Are there treatments available, or what should somebody do? When should they seek help?
Yeah, so for probably the most frustrating thing is this loss of sense of smell. And it's pretty clear that there are not a lot of medical treatments, meaning medicines to help. There are actually studies that show that taking azithromycin does not help. And in fact, azithromycin, not frequently, but does have a risk of damaging your ears. Hydroxychloroquine and chloroquine do not help protect you from losing your sense of smell or bring it back. So there are a couple of things that have been shown not to help. There is a study that shows that some nasal steroid sprays, kind of like nasal Nasonex or Rhinocort or Nasacort or Flonase, those are all over-the-counter, very safe, very weak medications which are inexpensive and very low risk. And there's a study that shows that it actually may help hasten the return of your sense of smell. So I think that seems like a very reasonable thing to do with very low risk and a potential benefit. One thing I will say about it is it's very weak, so it's going to take a long time for it to do much of anything, sometimes on the order of several months. So one of the options for improving your sense of smell is actually something called olfactory retraining. And olfactory retraining has been done for a number of years. Even with a common cold, there's a known incidence of people who lose their sense of smell. It's not anywhere near as common as it is with COVID, but it does happen. And for at least 10 or 12 years, we've been doing strategies to try and improve that sense of smell. And it involves using powerful odors in which you smell them repeatedly throughout the day. And the protocol ends up running about like 4 separate odors. And the easiest way to get these things is just essential oils. They're a really powerful smell, and it's easy to take with you, and it's inexpensive. And you do 4 smells, and you do each for about 20 seconds, and you do them several times a day. And you do 4 smells for 6 weeks, and then you get 4 different smells, and you do those for 6 weeks. And the longer you do it, the more effective it seems to be. And people who, at a year, that 7% of people who still have loss of sense of smell seem to still make some progress. It is not very likely that it gets you back to completely normal sense of smell, but it is pretty conclusive that this does help. The other thing is there's 2 different kinds of smell problems. There are what we call quantitative smell problems, meaning you have a little less smell or you don't have smell. And then there are qualitative smell problems. So qualitative smell problems, there's something called torqueosmia, which makes you smell everything like it's burning or gross. There's something called cacosmia, in which all the things don't make sense. There's something called phantasmia, where you smell things that aren't actually there, or parosmia, where you smell things that are there but you think it smells like something else. So those are how those things work is a little bit complicated, but it seems that using olfactory retraining seems to improve all of those different things. And it seems to be something kind of like, if your arm is weak, we give you a weight and you lift it, and you exercise that function of your body. And if you can keep retraining your brain to reestablish those connections, it can help. There are all sorts of things that people experience, and people clearly are having a lot of trouble with various parts or sometimes all of these parts of this. And there are options to try and improve this. It's not always easy, and there are some incremental improvements we can make, and it's worth having a conversation about could we do that for you.
Thank you, Dr. Vandermeer.